What is dysplasia and your pap smear results explained? Imagine a tiny change happening on your cervix that could be a warning sign for something more serious down the line. That's what dysplasia is. It refers to abnormal cells on the surface of the cervix, which is the lower part of the uterus connecting to the vagina. These cells are not cancerous yet but are considered precancerous because they have the potential to develop into cervical cancer if left untreated. This condition is also called cervical intraepithelial neoplasia, or CIN for short. Most often, dysplasia is found during a pap smear, which is a simple screening test that collects cells from your cervix. The cells are then examined under a microscope to look for any abnormalities. The pap smear is a vital part of cervical cancer screening because it can detect these abnormal cells early, often before any symptoms appear. That's why regular screenings are so important, especially if you are sexually active or have risk factors like human papillomavirus infection. Cervical dysplasia is mainly caused by infection with certain high-risk types of human papillomavirus, or HPV. HPV is a very common virus transmitted through sexual contact. Most HPV infections go away on their own without causing problems, but if the infection persists, especially with high-risk types, it can lead to abnormal cell changes on the cervix. These changes can range from mild to severe. Mild dysplasia, called low-grade lesions, often resolves on its own without treatment. However, more severe dysplasia, known as high-grade lesions, has a higher chance of progressing to cervical cancer if not managed properly. When your pap smear results come back, they can tell you whether your cervical cells are normal or show signs of dysplasia. Normal results mean no abnormal cells were found. Sometimes, results show atypical squamous cells of undetermined significance, or ASC-US, which are slightly abnormal cells often linked to HPV. Usually, doctors recommend repeat testing or HPV testing to monitor these changes. If the results show low-grade squamous intraepithelial lesions, or LSIL, it indicates mild dysplasia, which often clears up on its own. High-grade lesions, called HSIL, suggest more serious abnormality and usually requiring further evaluation, such as a colposcopy, which is a detailed examination of the cervix with a special microscope, and possibly a biopsy to determine the extent of the abnormality. Most women with cervical dysplasia do not experience symptoms, which is why regular pap smears are so crucial. When symptoms do occur, they might include unusual vaginal discharge, spotting between periods, bleeding after sex, or pain during intercourse. But these signs often indicate more advanced issues, so early detection through screening is key. Depending on how severe the dysplasia is, treatment options vary. Mild cases might just need careful monitoring with repeat pap smears. More significant abnormalities can be treated with procedures that remove or destroy the abnormal tissue, such as cryotherapy, laser therapy, or loop electrosurgical excision procedures. In some cases, a cone biopsy might be performed to remove a larger section of abnormal tissue. Remember, regular screening with pap smears and follow-up care are essential tools in preventing cervical cancer. Vaccination against HPV can also significantly reduce the risk of developing cervical dysplasia and related cancers. If you have concerns or questions about your results, always consult your healthcare provider for personalized advice and management. Early detection and proper care can make a big difference in maintaining your reproductive health.